Hello, I'm Paul Zaychuk. This is the fifth analysis of a sidekick. Please make sure to look at the previous 4 videos. First, take a look at the full sidekick performed in motion. Now, this is a good sidekick to analyze for several reasons. Number 1, because there's no shirt and you could see the flexion or lateral flexion of the spine. And number 2, you can also see the position of the hips more or less. Let's talk about the supporting leg first. As I have said many times, the height of the sidekick depends on the supporting leg. There is no way without moving the pelvis that somebody can kick high. So if you look at the lateral tilt of the pelvis, you will see that it's tilted pretty well, yet the right hip is not directly above the left hip. In other words, if you look at the line in the middle of the pelvis, you will see that that line is not horizontal. Tilting the pelvis more would allow the kicking leg to come up higher. So here, the kicker is positioned properly to elevate the leg higher. There's a complete turn out on the supporting leg, which means that there is not going to be a restriction in the hip joint, and the primary muscles getting in the way here is the medial hamstrings, the semitendinosus and semimembranosus, and adductor magnus ischial fibers and adductor longus. It's possible that other adductors are also getting in the way here, but usually that is not the case. Just a small tilt in the pelvis will make a large difference in the height of the kick. Now you can see the supporting leg slightly bent. Sometimes kickers are trained to kick with a bent leg, and that might be the case. Also, if the leg is bent, that means that the hamstring does not have enough flexibility for the leg to be straight. And if that is the case, then we know that the medial hamstrings is the primary restrictor here. Why is it the medial hamstrings and not the lateral ones? The lateral ones being biceps femoris are the main restrictors, because in a turnout position the lateral hamstring is shortened and the medial hamstring is lengthened, and thus, having been lengthened, more strain is put on it. Next, let's take a look at the kicking leg. So if you draw a line right between the pelvis and you draw a line along the leg, you would see if this is a 45-degree abduction in the kicking leg. Normal range of motion is 45 degrees. Some people have it a little bit less, some people have it a little bit more. If it is 45 degrees indeed, then you know that the kicking leg cannot do anything else. The height will be primarily now from the supporting leg. And finally, let's take a look at the trunk. It's interesting because you can see the body, there's no shirt. You can see the flexion of the trunk. This is a pretty good lateral flexion, although it can definitely be more. Based on the picture, you could see that more lateral flexion takes place at the thoracic spine than the lumbar spine. Whether that is a strength or flexibility issue, it has to be tested in person, because this kicker might have enough flexibility in the lumbar spine or in the lower back to flex sideways, but not enough strength in the muscles that keep that position, being the spinal extensors, the quadratus lumborum, the obliques, and the abdominals, all on the kicking side. Like I said in the previous 4 videos, this is a short range contraction. It's not easy to learn how to contract the muscles in their short ranges. The other muscle that assists in lateral flexion is latissimus dorsi. What I find interesting with this kicker is that his arm is behind the leg. A lot of kickers will either try to keep their guard and flex their elbow so that their hand is by their face, while many are taught to bring the arm up so it's pointing in the same direction as the kicking foot. If you look at the lats, you will see that they're activated, that they're contracted. Extending the arm straight allows the lats to pull the body a little bit more to the side. If the arm is not extended straight, it's a little bit harder to do. Bringing the arm higher will allow the lats to pull better. In other words, if the hand is pointing in the direction of the kick, which is in the same direction as the foot, which means that the arm would be higher, this would allow the lats to pull more, because in this position there is insufficiency. They're a little bit too short to pull. However, lower arm extended like that provides a little bit more of a counterbalance So my biggest suggestions here would be to use a ZST for the support and hamstring, to use extended length conditioning exercises for the support and hamstring, to check the flexibility of the trunk in lateral flexion. If the flexibility is not there, to work on it, and if that flexibility is there, to start developing more short range strength in the right side of the trunk. Another quick thing I wanted to point out is the chamber. If you look at the picture of the chamber, you will see that there's a turnout at the chamber. In other words, when the kicking leg comes up and pulled in before the kick, there's a turnout. I perform my kicks the same way. A lot of people perform their kicks this way also, but there are people who will lift the leg up vertically as if they were about to perform a front kick, and that is just stylistic differences, and people do it the way that they were taught or the way that it's more comfortable for them. If you are interested in developing your kicks, please take a look at elasticsteel.com for scientifically designed kicking programs and also flexibility programs and many other programs. I'm Paul Dajchuk. Thank you for watching.